Alright, ladies, we're going to go over a little bit of stoma care since we have a new individual that has it, so everyone can kind of get a basis on what I mean when I'm asking you for care for them. I got a little mannequin here. We're going to have our little pretend stoma right in this area. I know we don't have one quite right now, but that's okay. Um, For starters, this is going to be for assessment for my DSPs and my girls. I am not a doctor. I am an LPN working in a group home. First and foremost, for the stomas, when you need to call me for some of the things that you see in the house. If the stoma itself is a weird color, if it's purple, if it's blue, if it's white, if it's turning black, if it's an angry, angry red color, anything like that, call me immediately. You'll be able to actually see it through the bag because these bags are clear. And as far as care goes, our individual doesn't have any red or raw spots or anything like that. Generally, the nurse is going to put this spot on since we have the two-piece, which means if this falls off, if it pulls completely up against the skin, go ahead and let me know. And I know we have a home health nurse coming out there on a regular as well. We should not be pulling these off every day. You guys should not be doing this as part of the regular care for it. Generally, I'm going to be doing this part. But this should be on them already. I will do a little segment after for what nursing side will do on this one, but we're going to start with you guys on it. This is the bag that comes with it. These are the ones that we're going to be using in the house. And again, this is the part it's going to stay on the patient, on the individual. It will not be moving around. You don't pull it off for the shower, nothing like that. We're going to cut a circle around it, and like I said, generally that's going to be me, the nurse, doing that. A little bit bigger than what the stoma is. We're not going to be brushing the sides of the stoma because we don't want any of what's inside the body to get out on the skin. We want to keep the skin as intact as possible because that is our biggest concern, is the skin. Now this thing, it just pops right on there. We can set it up to where our little belt thing, because she does have a belt with hers, can go on it. But this thing, the bag, is what you're going to be messing with most of the time. It just pops into place. There's no clipping or anything like that. It's just like a Ziploc bag. You just pop it into place. And when you're putting it on there, you're going to be pushing it a little bit. Do not push directly on the stoma or anything like that. Let me know if the inside adhesive gets anywhere like pulling out at all, and any kind of fecal material is underneath it, touching the skin directly, because you need to know that information fairly quickly. But most of what you'll see is like this. And again, ours, we have a Velcro on it, which means there's a Velcro there and there. One on each side. Super easy. We're going to be doing it while it's on her. It'll be in this downward position most of the time. And this thing needs to be closed off when it's not in the process of being emptied. Our individual does not have the balance to stand over a toilet to do the emptying, but since this is a YouTube video as well, if yours at home does want to stand over the toilet and empty directly in there, or you guys think that she's well balanced enough to go ahead, then you go right ahead. What you're going to want to do is you are going to unvelcro this strap here and let it fold out. These are supposed to be designed where you can just push on the edges, but a lot of them aren't going to be as forthcoming. Now, I know you guys already have your gloves on because this is falling under the category of sticky and gross. So you know anytime you do sticky or gross, you've got gloves on. So we can kind of do that and push it out and let it empty. You can kind of push it out on that one. Whatever comes out of this bag can be flushed down the toilet just like normal. You want a piece of tissue or a wipe or something, whatever we've got in the house available, and wipe the inner lip of this with your tissue because you're going to be pushing that down flat. And if you don't wipe that inner one, you're going to push poop out the back. And then you're just going to fold it how it naturally wants to fold all the way back up. And just going to be kind of popping it back down like that. You're probably not going to get anything out of it every single day, but that's fine. But it is just like any other bowel movement. If you see any colors in it that shouldn't be, any pus, any fluids, anything that looks odd, extremely hard, go ahead and give me a call. And even though they have a stoma, they can still get constipated, which means if it goes 3 days without anything coming out of this, I need to hear about it. Or if anything even looks weird, I need to hear about it. I need to be getting phone calls for it. Now, on the other side of things, on what you'll be seeing on someone else changing it, either me or the other nurse, generally speaking, we're going to cut the hole for the shape, and we're going to have this. It needs to be washed all the way around the stoma. It's okay if a little soap and water gets on the stoma. That's not going to hurt it too bad. Make sure it is dry. We even got little wipes and things for the adhesive. So I'm going to clean the adhesive all the way off. Try not to touch the stoma with the adhesive wipes or the skin prep. I love the skin preps because they make things a little stickier. So you can actually do the skin prep, wipe around the skin as close to the stoma as you will on that one. Never touch the stoma with one of these. It will light the person up and they will not appreciate that. We also have cement, and I don't have a little extra bottle of the stoma powder, but that one's a thing too. Generally, I've seen people take it or leave it on the cement, depending on how much they pull and tug. I wouldn't worry about it unless we have to. I'm going to put some dots on these, but I got to use it. And this thing's already been prepped. We can put some of the stoma powder directly around the inner circle of it, but do not put stoma powder to the point where it's going to get underneath this adhesive here, because it can actually cause less of a stick. It peels off just like any other sticker, and it gets put directly on that. And hold the hand over it for a few seconds. That just kind of heats up the adhesive a little bit and helps it. You're going to want to go all the way around and kind of push it down flat, especially if you're using the cement. It needs to be flat, flat, flat. Now, the biggest things to worry about on this thing that need to be reported to me immediately is if there's any like pink starting to surround the edges of the adhesive where we're having some kind of reaction to the glue pretty much. If there's any kind of redness around the inside of it where you can see skin, or if there's any skin integrity issues. If you see any open skin when it's being changed and it's the other nurse doing it, then please let me know pretty quick if there's a skin issue underneath, because it can absolutely get into a nasty little cycle where there's infection on the skin and the adhesive pulls the skin more, no matter how well we're doing on the skin prep, or they get infected because of fecal material on the skin, and then we're going into the antibiotics versus we have to keep the thing coming on. That's why this thing does not need to be getting out. Let me more or less handle the timing on when this comes off. If we're changing the whole bag, we can just pop the whole bag right off. See? Generally, you don't have to do that unless it kind of gets really gunky, or every couple of days you can put a new bag on it. We have the home health nurse that comes out, then we can do the timing based on what she likes. But try not to push down too much little bites when you're putting it on their stomach, because you're pushing on their stomach, but you do want to make sure you've got a good seal going on. Now, I've been asked a couple times about wet and shower. If it gets wet, we can towel this one dry. If it's like dripping, sopping wet, just pull the bag off and get another bag. We've got the medical supplies. We don't need to worry about skin integrity by having wet touching the skin. It can cause some issues. You make sure that one's good, because it can actually leak around the rim if this is not on good. Make sure that one's good. Again, you're looking at the stoma. Whenever you empty the bag, go ahead and look at the thing. Make sure our color's good and stuff is coming out of it. If that stoma ever disappears and like sucks back into the body, you need to call 911. That's one of those do not pass go, do not collect $200. Call 911 immediately for that one. And then your little baggie up here, they can do everyday activities. We have a belt for her that we can put on occasion. We have little loops on either side. You can kind of see them. She likes to put hers in her belt loop specifically, so that's not really a thing we're probably going to be using every day for her unless she's wearing looser clothing. So that's not a problem on it. I'm trying to think if there's any other questions that I'm running into. Treat it the same as constipation. If she doesn't poop in 3 days, you need to let me know. That way we can get a laxative on her. Any kinds of infection or skin issues or concerns, you need to call me immediately. If you need talked through on how to change it and stuff, if you're one of my girls, you can call me and ask me anytime, anything about this, and I should be able to answer it. If you're one of the internet people, never feel afraid to call your medical provider for assistance. Now, most of the stuff should be where it is. If you're one of my girls, call me with any questions. Thank you.